Good. Hi, everyone. I'm Dr. Swanson alongside Dr. Martinez from KSB Foot and Ankle Center. We'd like to thank KSB Community Wellness and Aaron Fox for putting this presentation on for us tonight as well. As spring activities start to increase, we'd like to bring you some information on common skin conditions that we see. Some of the conditions that we would like to discuss this evening is poison ivy or poison oak rash, athlete's foot, a condition called erythrasma, and then burns. So first, poison ivy and poison oak. I wanted to include a couple pictures here. The main thing to bring away from these pictures is that poison ivy, they have more pointed ends to the leaves as compared to poison oak, as you can see. More so of how does poison ivy and poison oak cause a rash? Well, they both have an oil that can cause an allergic reaction called urushiol. When you touch the plant, this can start that allergic reaction on your skin. Touching contaminated objects that have also been in contact with this oil can also infect you as well. And if, let's say, a contaminated object isn't cleaned well, that plant's oil can actually cause a skin reaction years later too. Inhaling this smoke from burning plants is something that you want to be cautious about. Even the smoke from these plants can irritate or harm your nasal passages and lungs. So what are some of the signs and symptoms if you're in contact with poison ivy and poison oak? Well, you may experience redness, some itching, swelling, little blisters that may enlarge, black streaks and spots, and then difficulty breathing, especially if you had inhaled some of the burning plant's fumes. So treatments, this includes over-the-counter cortisone cream or ointment such as hydrocortisone, calamine lotion or creams containing menthol, and then oral antihistamines such as Benadryl. And when should you see a doctor? When the reaction is really severe or widespread, the rash affects your eyes, mouth, or genitals. Some of those blisters can become infected and you may notice oozing pus from them. If you happen to develop a fever greater than 100 degrees Fahrenheit, if the rash does not get better within a few weeks, and then if you inhaled the smoke from burning poison ivy and are having difficulty breathing, definitely seek treatment. Some prevention. Well, try to stay away from any contact with poison ivy and poison oak. Sometimes this can be difficult. If you wear socks, pants, long sleeves, or gloves when outdoors, that can be helpful. Keeping your pets from running through wooded areas so that the oil doesn't stick to their fur, because this can actually cause you to have a reaction as well. You can get rid of the plants by applying a herbicide or pulling them out of the ground, but make sure you wear some heavy gloves. Remember, do not burn the plants because those fumes can cause reaction. And then if it is in question of any contaminated objects, if you clean these, that can help reduce the risk as well.
So next we're going to be talking about,
Martinez.
Thank you. Next, we're going to be talking about athlete's foot. Just to take from those images is that they can come in various different forms, especially in the more sweaty areas of the foot, like between the toes or on the bottom of the feet. What is athlete's foot exactly? Well, it's actually a fungal infection called tinea pedis, and damp socks and shoes in combination with warm, humid environments favor the organism's growth. And so athlete's foot is closely related to other fungal infections that you all probably know, such as ringworm and jock itch. And it can be very contagious and can spread on the floor, on towels, and on clothing. And so it also can lead, if it worsens too much, it can lead to bacterial infections. So what are some of the signs and symptoms of athlete's foot? Well, you might see scaling, peeling, or cracked skin between the toes or on the bottom of the feet. You can get itchiness, especially whenever you take off your socks and shoes. The skin may appear inflamed and reddened. or purplish or gray, depending on skin types. It can be burning or stinging in nature. You can sometimes see blisters as well with athlete's foot. And it tends to be in a what's called moccasin distribution, which means it goes along the bottom of the foot, kind of like a moccasin shoe. What are some of the risk factors of getting athlete's foot? Wearing enclosed shoe wear too often, especially if you have excessively sweaty feet, sharing mats, rugs, bed linens, clothes, or shoes with someone else who has this fungal infection, or walking barefoot in public areas such as locker rooms, saunas, swimming pool areas, communal baths, and showers. And ways to prevent athlete's foot is to make sure you let your feet dry out. You wash your feet at least daily. If you tend to have this infection, you can always use a medicated foot powder such as Tinactin, Gold Bond, Lotrimin. Make sure you change your socks at least daily as well. Alternate pairs of shoes to let them dry out, and protect your feet in public areas by wearing flip-flops or some other kind of slipper. The treatment for athlete's foot tends to be antifungals such as terbinafine and clotrimazole. But if it gets too bad and you end up having a bacterial infection, you may need antibiotics as well.
Good. So next is a condition called erythrasma. So it can present very similar to tinea pedis or fungal infection, but this is actually caused by a bacteria called Corynebacterium munitissimum. And so it is often confused with athlete's foot or tinea pedis, as we just mentioned. It does present as wetness and itchiness between the toes or in skin folds. And due to it being a bacterial infection, we treat it with antibiotic, and typically is erythromycin.
Another condition that is common on the feet, especially in the summertime, is burns. Some at-risk populations for these types of burns are the elderly, children, and patients with neuropathy, especially diabetic neuropathy, where you have decreased feeling and sensation on the bottom of your feet. Some treatment, if you do end up having a mild burn on the feet, is to make sure you clean the area with some mild soap that's not fragrant filled and with some cool water. Make sure you apply some petroleum-based ointment, not any lotions or creams, and cover with a nonstick dressing such as a gauze or a cloth. You can use over-the-counter inflammation medications such as ibuprofen to help with the pain. Make sure you stay hydrated and stay off your feet as much as possible to allow for healing. To prevent these burns from happening, you want to make sure you're wearing shoe gear when you're outside. And if you have children or you're out with elderly population and they're going to be barefoot, make sure you put the back of your hand on the sidewalk to feel how hot it is. And if it burns to the touch, you should not be going barefoot. And make sure you're wearing sunscreen on the feet as well. You should see a doctor if you're concerned about the burn, if there are any signs of infection, like increased pain, redness, swelling, fever, or oozing. If there is a burn blister that is larger than 2 inches and it oozes, if there's redness and pain that lasts more than a few hours, and if the pain is consistently getting worse.
All right, well, great. Thanks, Dr. Martinez. Well, good. Well, that concludes our presentation for tonight. So if anybody has any questions, you can sure leave them in the comments section and we'll get back to you. Once again, we'd like to thank you for joining us tonight, and thanks again to KSB Community Wellness and Aaron Fox as well. We hope you have a fun and safe spring, and we'll see you soon. Have a good night.
Thank you.